Hi everyone, I am Dr. Vibhor Borkar. I am a pediatric gastroenterologist, hepatologist and liver transplant physician practicing in Mumbai and Western India. Have you ever noticed that your kid might be complaining about tummy troubles when it is around exam time or school time? It may not be just nerves, it may be just a part of Irritable Bowel Syndrome or IBS which gets triggered by anxiety or stress. Let's see how anxiety and stress can actually trigger irritable bowel syndrome. Inside our body, there is something called as gut-brain axis. What does it mean? That our brain has a connection with our intestine. So our intestine does move automatically, but some amount of gut contraction is affected by our brain signals. So whenever there is a stress, brain sends some signal to the intestine. Because of that, the function of the intestine, that may be contraction, relaxation, or even increase in the secretion, that may get affected. Because of that, one can get pain, diarrhea, or constipation. That's what called as a gut-brain axis related pain, and it is triggered by the emotion. So do remember, whenever someone has these functional disorders like irritable bowel syndrome, though it is triggered by the emotion, pain is real. So do not ignore it or just say to the kid that okay, this all pain is in your head. In fact, it may worsen the problem because you are not supporting the child emotionally. In kids, let's see what are the factors that can trigger these emotions and aggravate irritable bowel syndrome. So simple daily routine things like school stress, exam anxiety, peer pressure, or any family stress. Even these are very simple aspects in a child's life which can be emotionally challenging to the child, and child can have a functional disorders like irritable bowel syndrome. There are certain aspects how to manage this. One is breathing exercise. Taking a deep regular breathing can calm down the nerves and child can feel better. Second thing is journaling the event so that child can basically plan the routine. Third thing, having a very nice routine so that there are no unexpected things that happen, and that decreases the anxiety. A small subset of kids may be difficult to handle, and these kinds of kids can need a directed therapy like a support from a child psychologist. So whenever child complains about pain in abdomen, we have just seen it's a real pain. So don't just say there is nothing. Just validate the pain. It gives a lot of support to the child's emotion. So when your child has a stress related pain or IBS symptom, it doesn't mean he has done something wrong or child is just doing to give some reasons to avoid any particular situation. Validate the pain, validate the emotional support that he needs, and with your love and understanding, we all can help your kid to manage IBS related disorders. So if you find this video informative, don't forget to like this video, forward it to the person who needs it, and subscribe my channel. Thank you.